Hi everyone, we might get started. Just thought we'd have some boppy music to get you all going for this time of the day. It's lunchtime at my place, so it's always been lunchtime when we've had these videos, and it just nearly, it's awful watching this. Not awful watching, I shouldn't say it like that. It's great watching the videos, but it's not good for me looking at all this beautiful fresh food that the videos have had on there, and it makes me very, very hungry. So before we start, I'd like to acknowledge all the traditional custodians of all the lands you're on today in all different parts of the country. I'm on Wurrumai land today on the north side of Newcastle. And I'd also like to acknowledge past, present and emerging Aboriginal and Torres Strait Islander people online today, and also our non-Indigenous sisters and brothers online here for our third Healthy Stories and Good Food webinar. While we're talking, if you've been on for the last, this is our third one, if you've been on, you know what I'm going to ask next. So I'd like people to write in the chat where you're from and what Aboriginal land you're on today. I'd also like to acknowledge all the different languages that we have in the big M you can see on the screen there next to the Aboriginal, next to this, I'd like to say Aboriginal map, Australia map of Aboriginal countries. So you can see all the different languages we have on there. So if people can put in where they are sitting today, where they're coming from, that'd be great. Before I go on, I would also like to acknowledge Julie Brimbleco, who's online here today. Without Julie getting in contact with people, organising all the presenters, organising everything that's happened. Number 4 webinars on tomorrow, but everything that's happened so far, Julie. So I'd just like to thank you from me, and I'm sure everyone else online appreciates all the work that you've done. Without you doing this, and Stacey also, Stacey Holden online, this wouldn't have come together. So I just want to acknowledge both of you in this. So housekeeping, we are recording this. We're on record already, recording everything that's been done today, so we can watch it again. And Julie will put in the chat shortly the other ones that we've already done, the other 2 that have previously been done, and where you can find them. If you can have your cameras off, it makes your internet a lot stable. We're learning all this about how we can keep our internet stable over the last year so it doesn't cut in and out. Microphone's on mute. Question and answer time will be in the chat. So as we go along, I encourage you to put in questions for the presenters. We are having short videos, then we have some presentations, and then we'll be having question time at the end. So it's great if you can put some questions in the chat for our panel. And then we'll have showcasing of the stories, like I said, interview with some wonderful nutritionists that I'm really, really looking forward to, and a presentation, and then question and answer for the panel. So moving on, I also, when we do have the videos, I just wanted to let people know some of them might be a bit quieter and some of them might be louder, so you can just adjust your volume to this. On the screen here, you will see something that if anyone has seen any graphic recording before, they'll know about it. If you haven't, you're in for a real treat. So we have Sarah, who is our graphic recorder, and she's just brilliant, as I am. I'm a very visual person, so I like to see everything. So since the first couple of sessions, Sarah has made up these wonderful recordings about everything that's been said. So you can see this was from our last session we had yesterday, and it's just incredible to look at and go through what we did. So we had the 4, as you can see, the 4 videos we had and what they talked about. And, you know, we heard a lot about employment, locally accessed bush foods, how important it is, how it's important to make sure we get food to community, how that happens, supporting people with where they want to live, which come out also. So people should be able to live where they want to live, our Aboriginal and Torres Strait Islander people, and be able to get access also to good food. And I've talked about this in everything we've done about it's a human right to have access to good, healthy food and good, clean running water. So thanks, Sarah. You'll be able to see Sarah on the side of your screen there, so you can click on that anytime and you'll be able to see how she's going with this wonderful design that she does. So now you're in for something great. So we've got a couple of short films that we'll get into now. Gang Gang Community Homeland Store and Thursday Island Store, quality staff, quality fruit and veg. So sit back, enjoy the short films and take notes, and remember, put your questions in the chat and we can ask the questions after the, when we get to the panel later on. Thank you.
Ya ko ngara mai ko mununguru ka bapur ngara japo. Ajama ngara more than 10 years. Their shop point. It is difficult to get into town because some us community doesn't have a transport to get into town. So this is why we need our own shop in Ghana community to stay and do our shopping in this Gangan store. It helps this store helps my Magata to feed our Jamakuli and our own people because in this shop we have a cheaper, like we can't afford to go into town. And more better, we spend our rupiah money in this shop. It's more cheaper than the Willis and other stores.
The vision of the store for us was to address food security and provide, community access to affordable and nutritious food. We're using the stores for training, it's improving employment opportunities for community, and it's just kind of evolved from there. The shops are getting busier and busier and busier. So we're a team of 3. We kind of do all the logistics of running stores.
So with the shopkeepers, I'm working with them to go on Woolies online. We go through the stock in the store and find out what we need, and then we write up our shopping list and we place the order with online with Woolies. Then the delivery comes through C-Swift, we pick it up, pack it on the ute and drive it out to the community. So that takes us a few hours to get out there, and then we'll do the same again for next fortnights. And then that'll then take another 2 weeks before the next delivery comes out to community.
Hi, my name is Felda Wanambi and I'm from Vanilla, Homeland.
Hi, my name is Seki Shaganambar and I'm from Gangan community.
My job is to serve people, and we have a job list here to do cleaning. So we serve half-free food, and we don't serve sugar syrup in this shop. We don't sell any soft drink, early smoke in this shop. It costs 550.
They used to get a lift with the liner staffs or by bush taxi. It cost them maybe $6.50 one way. Get like flour or rice and tin foods, some drinks. In Nolanbo you get, been getting hamburg and couldn't get what I want. Good for people to, maybe stay here instead of going town. And it's good to have shop here and made a bit of changes. Like they like pumpkins, buying pumpkins, sweet potato, but purple ones. Anything that, all the healthy stuff, like fresh stuff.
When if we run out like groceries, foods, and all the stuff in the shop, we got our Yolongata. Now's the day, as you can see, we called in our Yolongata Mudawara. Now's the time to go out to the bushes and get some our Yolongata.
Yeah, they went to get some yams there, yeah. This is a yam season right now. We still thinking, still know what leaves look like. Yeah, it is minimal.
Yes, so I think our community stores have been a good example of what can be achieved if you work closely with the community.
I'm proud of this in the shop, the work, and even that the community, the landowners, they are proud of this community and the store as well.
Yo, Sakishan, Manmakata.
Puai kun kan gam. Margaret Larry, been CQ for 21 years. Has started off back in 1989 as a shop assistant. Ended up being a manager back in 2000. Then part of that carried on to do mentoring right through to the Cape stores. I visit most of the Cape stores, come back and end up being a regional manager plus mentoring as well. Mostly communities, some stores have problems with staffing, so I go out, work with them together, train them up skills or find out what's the problem, fix it up. Yeah, so that's part of mentoring.
My name is Harriet Bunny, and I'm the assistant manager at Thursday Elementary Store. Manager at Mobiag Island in 2013. I started there. I started working as a casual, and then I got training Cert 3 in retail, and then got the position for the store manager at Mobiag, and then we did numerous trainings after that. I do the rostering. I also train the register checkout when they first get employed. So I train them through the register and that. I also train staff on the floor on how to do day coding, how to price check items. So teaching them as well, so giving them the opportunity to do it themselves, so it makes our job easier, so we can offload the work to our workers. And plus our staff, like Indigenous staff, they find it more comfortable talking to us as an Indigenous leader to them, so, and they understand and learn more.
My name's Casey Kelly. I'm the General Manager of Merchandise here at Community Enterprises Queensland. We work really closely with our suppliers to ensure that they're providing good quality and priced produce to our remote stores. Yeah, we work really closely with suppliers to get the best quality and best priced products. Our suppliers source locally and through the markets daily, just to make sure that the prices are kept down and the quality is high. Our pricing model is to be in line with mainstream as much as possible.
Hi, I'm Rita Mosho. I'm from here at Thursday Island. I've been working for IBIS for 25 years plus. I'm the manager of Chamoy IBIS. I worked 12 years at the IBIS main store and 13 years here at Chamoy. Yeah, I do train other staff that are working with me. I have another casual and a part-time worker, so yeah. Well, for me, I reckon it's like as a store manager, we get to do the orders ourselves before we send it through, before they process it through. So we get to order more stuff, stock in. Some of the elderly people are buying more of the healthy food, yeah, and middle age, yeah.
My name is Sarah, and I'm the store manager at Rosa Libus. I got my training through CEQ and previous employments. Yeah, I'm from TI, and I love working with my people, and yeah. I got my training done with Margaret and the Mr. Smiling Ata. I love them. I get a few customers, well actually a lot of customers ask if we stock certain food and veg, so I try and put an order in and try and get them up. Great. So just maybe, yeah, stuff customers request, and I try and put them on orders and yeah, get them up here. Yeah, I like to keep my customers happy by ordering like what they ask, and just try ordering the stuff and try and get what they want. Yeah, because customers always comes first.
Wonderful. So a couple of more wonderful stories, very innovative, and it just makes me so happy to see people working in community, training in community, and making sure there's healthy, fresh food. And that food was just amazing on both stories, and the work those people are doing is just incredible. I just wanted to also mention that we did get a lot near the end of this. We'll show the actual committee that all the videos got sent to. We got a lot of videos, a lot of short clips that we had to go through and work out which ones we wanted to put on, because we couldn't do them all. But how we did this was looking at well-established stores, well-established organisations related to the store and or takeaway, evidence of community involvement, which is really, really important, making sure the community is involved, looking at employment, looking at leadership, all those things that have come through in all the videos that we've watched over the last 3 sessions, and aim to improve access to health, affordable food. So we see that. So that was the criteria. We got lots of videos, and unfortunately we couldn't do them all, but we're sort of doing a snapshot of the ones that we think that are really good, and go through all those. But the other thing is, I want to mention that all the stories are going to be on the Monash website, and I'm not sure if Julie's put that up yet, but it'll be up in your chat shortly, looking at the website. So you can go back to the website. If you have internet problems, don't worry, it's all going to be, as I said, all recorded. You can go back and see that. I'm very privileged to do this next interview with Dr. Lisa McCarthy, Executive Director, Central Australian Academic Health Science Network. I've known Lisa for a long time, and I went back in my late 30s to do a nutrition degree, and Lisa was one of my heroes that I always read everything that she did and looked at everything she did, and now here I am interviewing her, so I still feel very privileged, Lisa, to have you here with me today to go through a few questions with you. So welcome, Lisa, and for anyone that doesn't know Lisa, she's been in the nutrition field for a while. I won't say a long time, a while, and done so much work that she will talk about as we go along. But I've got a few questions that I'll go through with Lisa, and I'm sure she'll add more to that. And it's really good coming off the films we just seen, looking at logistics, travel, remoteness, all those things that are really important to make sure we get healthy food into remote communities. So Lisa, I might just start with a couple of questions. And is it just food that costs a lot more for people in remote communities, or is there other commodities as well that's hard to get and cost a lot? So I hand over to you, Lisa.
Okay, thanks for the introduction, Nikki. Yes, it is a long time, and I don't know whether I'm an expert though. I'm still learning a lot more. But anyway, yes, is the short answer. So as we know, food has always been on the agenda in remote communities. It's costing a lot, but we also need to have the implements to actually prepare, cook and store food, and that's also quite expensive out there. For instance, if you're wanting to purchase frying pans or eating utensils, all that is also very expensive.
Yeah, it's always an issue with all those, and that's the other thing we talk about: infrastructure and making sure it's all right to say we've got food, but have we got the infrastructure and proper utensils to make sure we can cook the food? And I know there's always issues with electricity and different things and water in communities that we talk a lot too. So it's not just having that food; it's also having those other things also. So when we talk about how does this impact on what people prioritise to buy? So we're thinking about, when we're thinking about food and other things, is food a priority, or depending on where you can get it from and what you can do with that?
Yes, so just there is also pardon me, I'm just going to cough. There's also how people prioritise what to buy according to, as you just rightly mentioned, Nikki, whether people have a refrigerator or they have electricity to run that refrigerator. So you'll often see people purchase dry goods, for instance, not perishables. There's also, because of the cost of food, people prioritise more energy-dense foods over, say, more nutrient-dense, because that's going to stretch further and fill people up. So there are many issues in terms of what impacts on what people prioritise to buy, and as I just mentioned, it's often related to the circumstances, but also to the infrastructure within the home.
Yeah, and it's really important for people online that don't know much about the basic card and electricity card and different things that people have in remote communities. That's something else to look up for people online that might know about the basic card. There's only certain things you can buy, and there's a lot of other challenges around that also. So I thought I'll just put that in there for people to look up. Another one with Job Seeker and JobKeeper that the government put in, especially around the last year with COVID, people in community have access to more money than before. Did you hear or see differences in people shopping as a result of having more money, do you think?
Anecdotally, the evidence does show that there was an increase in sales of food, specifically fresh fruit and veg, but also the other commodities, so refrigerators, other household goods. So definitely we did see an increase in that. And there are a few preliminary studies now looking at that increase. So whether it was just because people were in lockdown, or was it because of the increase and they couldn't spend their money outside the community, or was it because of the actual increase in income?
Yeah, that's really interesting. I look forward to hearing more about that, and that that'd be great if we could give people more money to buy those commodities to help out with having healthy and cooking healthy food. There is no doubt that supplying food to remote communities from southern markets suppliers is going to cost a lot. What else needs to be done to help support people to stay on country?
There is a lot more that can be done. So, for example, one element is how the stores actually run as businesses in remote regions, whereas we know that the store is often the only provider of food, or is the only food source in that community other than what people are actually gaining from the bush. So one way of looking at this is that the stores are actually an essential area or an essential business within the community. So it should be treated so by the governments, for instance. We know that power and water is, we know that schools are, we know that police, etc., but not the stores. So there are very, pardon me again, there are elements to look at how we can actually make, and you rightly mentioned before, Nikki, where you talked about food being a human right. So this is about making it an essential service because it is a human right to food. So in terms of getting food from the southern markets, we often hear that freight costs impact on the cost of food in remote communities. Now, there are also other additional costs, and we're very unclear what the actual, that there's no transparency with why food costs more out in remote communities other than freight. So, for instance, we know that to actually employ people within the store needs to make a profit off the food they sell to actually employ people. To actually look at maintenance within the store, that again comes from the money that the stores are making from the foods. So if we're looking at it being an essential service, they're then open to more opportunities where grants are provided to fulfil some of those areas. We know that there are grants in Northern Territory that are offered to store managers for maintenance, but then that requires people to have the time and the capacity to complete these grants, to apply for funding. So often that becomes the larger stores or the co-ops that actually have more of that capacity, not the individual little stores.
Yeah, that's really interesting, and thinking about that, it's really interesting for people online to think about that. There's lots of different things to think about, and I've had this tickle in my throat, and every time I go to talk, I want to cough too, Lisa, so I understand.
I'm just suffering from a cold, so yeah.
Yeah, me too. I went to Northern Territory, same as you went.
Yeah.
Northern Territory, beautiful warm weather, come back to the cold, and here we are. Yeah. Something else I was thinking about is food pricing and food affordability. What do you think about that, and what are our barriers, and what are some of the solutions we can think about, or controls we can think about to make this a lot easier, and I suppose you've seen a lot in the years that you've worked, the changes. Has it got better, and what have we done to make it better, or are we still a long way off? There are lots of questions in there, but you can just sort of talk about, I know you know all about that, so we sort of just start off what you've seen over the years, I suppose, how it's got better.
Look, I think over the years there have been small wins, and these have been through some of the great work, obviously, that Julie Brimelcombe and others have done. And that's by working in partnership with stores and to actually look at how stores can be better supported. So we have seen improved, quality of fruit and veg out there. We've seen improvements in refrigeration facilities and in some areas. So there have been some small wins. There's also ways that, the cooperatives like ALPA, for instance, the Armed Land Progress Association, where they've worked very closely with nutritionists for a number of years now, and also others, and that have improved and have actually looked at how they can work together to improve the food supply, but also looking at how point of sale can also be looked at in terms of making fresher produce and more healthier produce cheaper. So I think we have seen some change. But these changes have only been very specific to regions where work has been undertaken. So it would be really great to see government step in, actually, and as I said before, make stores an essential service, and to also look at more regulatory programs across Australia. And this is what was also noted in the food pricing inquiry as well, where there's more transparency in pricing, where there's also been suggestions of having better support for stores in terms of store managers, but also looking at the employment of store managers and how to assist communities to do that, specifically with stores that are individual stores. So there are ways that we can look better or more to the future in looking at how stores can actually be a better service for the communities.
Yeah, that's all really important. There is a question here that's come from the audience. Hi, Lisa, how can we stay up to date regarding the studies underway about how increased income support change purchasing behaviour? You mentioned that earlier. I'm not sure if you know who's doing the study or what's out there. If you can let people know where we can find those studies.
Yeah, those studies are only just very preliminary at the moment, so they're not actually underway. And I think there is one, and I'm trying to remember whether it was ANU or somewhere else that was actually looking at the actual impact of JobKeeper and JobSeeker on remote communities.
Yeah. Okay.
Yeah, so once I find out more, I can share that with Julie Brimblecombe and or whoever's convening, and we can look at it further.
Yeah, great. Okay, Lisa, that is our time's up. So thank you so much. Was there anything else you wanted to mention before we finish? I think you said about government, what we need, what we should be doing moving forward.
Well, it's probably the same old thing, I suppose, if we're looking at all those inquiries. But also, we had, and this is the National Aboriginal and Torres Strait Islander Nutrition Strategy and Action Plan. So there was a very good way of addressing some of these issues through NATSNSAP. And obviously that document came to an end in 2010, and there was no future direction from that in terms of another strategy or even in any type of national policy for Aboriginal and Torres Strait Islander food and nutrition. So it would be really good to look at how, as the jurisdictional governments, but also federal government, how we can actually address some of the store issues by revisiting that.
Yeah, great point. 10 years ago, 11 years ago now, NATSNSAP, which we're all involved with, and 11 years on, and we still haven't got an Aboriginal and Torres Strait Islander nutrition policy. So there's a lot of us been pushing for that. We still haven't got there. So I think that's a really good recommendation that we can keep pushing towards. So thank you, Lisa. It's been a privilege, and keep up all the great work that you're doing in communities and with our people. So moving on now, we're going to have a presentation by Claire and Carolyn. So I'll hand it over to Claire and Carolyn to start their presentation and bring all the great work that they're doing in communities to us.
Thank you, Nikki. We'll just try and share our screen. Can everyone see it?
Thank you. We can see it. Thank you.
Thank you. So before we start, we would also like to acknowledge the traditional custodians of the land on which we stand today and pay our respects to elders past, present, and those that will lead us into the future. And we're in Kanyama today, and so we particularly like to pay our respects to the Kookaburra, Kookamadjan, and Kunjin clans. So my name is Claire.
And I'm Caroline.
And for the next few minutes, we're going to be talking about food affordability and food pricing for healthy food. So as mentioned, I'm Claire, so I'm a public health nutritionist. I'm the nutrition team lead at Apunapina, and I've been working in Cape York for the last 4 years, but before that, about 6 years in Northern Territory with a mixture of top end and central.
And I've just joined Apunapina working on some food security work, and previously I worked as a public health nutritionist in the Northern Territory in remote communities. Firstly, I'll just give a bit of background to Apunapina. So Apunapina Cape York Health Council is an Aboriginal community-controlled health organisation that delivers primary healthcare services to 11 Cape York communities in far north Queensland. We've been advocating for improved food security and food affordability for many years. Cape York is a very remote area, and this presents significant barriers for people to access nutritious food and consume a diet that supports good health. The cost of food is approximately 30% higher, and the median income is about 30% lower than urban areas. So this results in a situation where families are forced to spend a much higher proportion of their total income on food. And as I'm sure everyone on this webinar is aware, this is not an uncommon situation for families in remote communities across Australia.
So addressing the social determinants of health is a priority for Apunapina, and for many years we've been advocating for cross-sectoral action on food security. In 2017, we released our board-endorsed position statement. And in this position statement, we have 7 key calls to action around food security. I'm not going to go into too much detail. It's available on our website, and I'll pop the link in the chat. But food affordability is a key component of this. And so this includes a key action on implementing a direct consumer food subsidy to address financial issues. And so a few years ago, Apunapina explored implementing a direct-to-consumer food subsidy through the use of a small feasibility study looking at using store vouchers to promote fruit and vegetable purchases and therefore consumptions.
So we are now expanding on this work as part of a larger partnership project with the University of Queensland and Central Australian Aboriginal Congress that will test approaches to improve the affordability of healthy diets and bring together community-led solutions to improve food security. One component of this will be to test how price discounts for healthy food impact on the affordability of a healthy diet. This is just one example of where health services can get involved, but food security is everyone's business.
So food pricing. So remote stores are operating in one of the most complex food retail environments in Australia. And there are many factors that contribute to this challenging environment in which remote community stores operate in and which substantially increase the cost of food and goods. And this includes the well-known things like freight, maintenance costs, high overheads, often poor infrastructure, and of course the distance that the food and goods is travelling. But another key thing to consider, which often isn't always discussed, is around economies of scale or lack of in regards to remote communities. So the cost of doing business in communities with small population sizes is significantly higher than in areas with larger populations like regional towns and cities. So small population sizes impact on the volume of sales and turnover that a store can do, which in turn influences how much buying power or negotiating power a store or store group has. Remote stores make up a tiny proportion of the national Australian grocery food market, so about 2%. And so as a consequence, they've got significantly less ability to negotiate on price compared to the large supermarkets. So often these large supermarkets can actually sell goods to the public at a cheaper price than what remote stores can actually access from their wholesalers. So on top of this increased purchasing or buying power, there are a number of strategies that large supermarkets can employ that remote stores don't get the same level of access to. So for example, reducing prices to customers through considerable promotional pricing funded by manufacturers. And the large chains also have that ability to supply a larger range of generic products, which is generally cheaper than a branded version, all of which helps to reduce the cost to the customer. So as a consequence from the very beginning, there is this price inequity for remote community stores and their customers. And then this is further compounded by the high freight and operating costs. And so resulting in community members in remote communities paying considerably more than their urban counterparts.
So many remote community stores do have pricing policies in place that support healthy purchases. So this can include freight subsidies or subsidy price increase combinations, i.e. preferential pricing, where you may increase the price of an unhealthy option like Tim Tams or soft drink to reduce the price of healthy options like fruit and veg and water. Another strategy includes working with preferred suppliers to reduce cost and have consistent pricing. These policies are limited by the need to sustain a viable store within the logistically challenging environment.
So what's the evidence around food pricing policies? So the remote food retail sector in Australia has been working with researchers to produce high quality evidence on what can work to support customers to purchase healthy food. So in late 2019, about 30 remote food retail stakeholders came together to co-design a set of policy actions that would be considered acceptable, effective and feasible to inform store policy to create healthy stores, to help support stores in remote Aboriginal and Torres Strait Islander communities. And so evidence from research from around the world, but also a lot of what had happened in remote Australia, as well as from store owners and retailers, was synthesised together to develop industry and research-informed policy actions. So there's a link here on the slide, and Dr. Megan Ferguson will be speaking about this tomorrow. But here you can see one of the policy slides around price and price promotion, and it provides a number of recommendations in regards to pricing for remote communities. So there is strong evidence that discounting healthy foods leads to more sales. And so recent evidence from the Shop at Rick study, which was a large project in Northern Territory with 20 remote Aboriginal and Torres Strait Islander communities with Alpha and Outback stores, showed that a 20% discount on fruit and veg resulted in about 21% more fruit and 9% more veg being sold. And these findings are similar to studies that have been done in Melbourne and New Zealand. But what about unhealthy food? Well, the 8% tax on non-essential food and drink items in Mexico showed a reduction in sales of unhealthy food and drinks with this tax. And other countries that have had a 10% tax on soft drinks have shown a 10% reduction in sales of soft drinks. So where does this all lead us? Well, basically, there's only so much that remote community stores can do to help close the gap between remote communities and urban areas in regards to pricing. So we need to take a multi-sector approach to address this. For example, looking at government subsidies to meet this price gap for healthy food, alongside infrastructure funding and support, as well as restrictions on retail promotion of unhealthy food. In addition, all good policy needs to make sure that we have strong monitoring and reporting systems in place to make sure it's doing what it should be doing and checking that it's still working. And in the meantime, we will continue to advocate for a multi-sector approach to addressing these issues that stores and community members face, for example, the high cost of foods and low incomes. And thank you very much.
Wonderful presentation. Thank you, ladies. Something that you said was really interesting and that I talk about a lot is social determinants of health, and we have to think about that. It's not separate. Everything's not separate for us as Aboriginal and Torres Strait Islander people. We have to think of everything in holistic terms, and I think that's where it also come out when the closing the gap targets were refreshed, and now they're included language and health and education and housing. It all comes together, and it's really important to think about that. Everyone online must think about social determinants of health before you think about anything else with Aboriginal and Torres Strait Islander people. How can you need to look at it, you need to know about it, and you need to have a look at the closing the gap targets and making sure in your role that all those are covered also. So now we're going to go on to this wonderful panel of people. You can see online here, we've got the wonderful group of people that are going to talk about some more about what they do and how their job is and what community they work in and different things like that. So I've got a few questions for the panel. So I might start with Karina first. And so Keisha and Mark in the film both referred to not selling sugary foods and cigarettes. Can you tell us more about this and if the homeland communities have put this policy in place? Thanks, Karina.
Hi everyone. The stores don't sell any confectionery, soft drink and cigarettes, and I guess this couldn't have been achieved without the full support of the community. We definitely had a lot of robust community meetings to discuss this, and it really came back to the store vision, which was about providing reliable access to affordable, nutritious food. And so those types of products didn't really come into that picture. Also, I mean, the stores are funded by Lanapoi Health, so a health service, and we didn't really want to be contributing to the negative health impacts those products can have on people by bringing them into the community. So that's kind of how that came about.
No, it's great, wonderful, and great for you and the community pushing all that forward. So that's great. I have another question for you. The groceries you deliver to the homeland stores are purchased from Darwin Woolies and barged to Yirrkala and then driven 2 to 3 hours or more to the homeland shops. So I just wanted to make that clear to people online that it's just not one process, it's many processes to get it to where it has to be. There's a lot of food miles here that costs money. Can you tell us about the model that Lanapoi uses to keep the cost down on basic groceries in the homeland stores?
I mean, Lanapoi run the shops as an essential service. So it's run as a not-for-profit so that the food can remain affordable. And so Lanapoi uses regenerated funding from their health service, and they put that into the stores, so that to the benefit of the whole community. Also, I guess the team that works with the stores, you know, we do everything from the logistics of running a store. It's a really busy job, so I guess everyone's kind of expected to just get in there and do whatever it takes, whatever is required to make that project successful. Yeah, did that answer? Sorry.
Yeah, that's wonderful.
Right.
Thank you. It's just just letting people know about the whole process and how difficult it is, and that it takes so much money and time from people. So thanks for that. Yeah, Karina. Carolyn, I might go to you. And when you first visited a remote community, can you share with us what were some of the things that struck you with regards to food affordability? Because it is quite confronting for a lot of, especially younger people going and working in communities. And I hear lots of stories about this. I do lots of work with dietitians that are going to remote communities. So, what sort of some of the things that struck you when you went into the community?
Yeah, sure. So actually the first community I visited in my role based in Alice Springs was Apatula, also known as Bink. So that's 5 hours drive from Alice Springs, and most of it is on, quite a fair bit of it is on dirt roads. So you do need a 4-wheel drive to get there. And there's a very small community, a population of like 200. It was a private store. And the food variety was fairly limited. They get deliveries every 3 weeks, and I went there, I think on the 2nd week, and I noticed that the fruit and veg was not of a great quality then, and there wasn't that much of it left. Then seeing clients, because I was working as a dietitian as well as a public health nutritionist, very frequently food affordability was mentioned as a barrier to people being able to have a healthy diet. So yeah, they would say we can't eat more meat because it's too expensive. So it was very normalized. So on the off-pay weeks, people would be relying on those filler foods or asking family or friends for food, or often also mentioned going out hunting. So it was something that seemed to be normalized amongst the whole community, and there were very high rates of malnutrition among both adults and children, but also very high rates of overweight and obesity due to those reliance on those convenience foods.
Yeah, thank you for that, Carol. And again, anyone online thinking about, everyone say, I want to go and work in a remote community. I say you need to learn a lot of things before you go there, know a lot of things before you go there. And, that's all about being culturally responsive. So thanks for that, Carolyn. Claire, a key recommendation from the government food pricing inquiry to address food prices and food security were to open the remote community market to more competition. Does this recommendation miss the fact that it cost a lot to cover the food miles needed to get food geographically to remote places?
Yeah, I think that's a bit of a tricky question. I mean, competition can only bring down the price so much. Like I've already kind of talked about some of the challenges that remote community stores are facing in terms of keeping the cost down. And to be honest, we don't really see Coles or Woolies lining up to operate remote communities. So I think there's a few different challenges that bring in. Like, I mean, if you're looking at more competition, you're potentially looking at private enterprises rather than a range of different Aboriginal or Torres Strait Islander corporations that might be running the stores. And I think that's a really important thing to consider when you're talking about ownership and self-determination. And it also brings in some other challenges from a nutrition perspective. So, if there is competition in community, sometimes it can be harder to have those hard-hitting nutrition strategies like taking 1.25 soft drinks out of the fridge if the other store, for example, isn't doing the same side of things. I think we need to be looking at it much more holistically than just thinking about opening up for competition and market, because as I said, there are many things that make it quite expensive in communities and for stores to operate. And I think we need to be looking at how we can have a bit of a more strategic approach, whether it's through government funded subsidies like direct to consumer subsidies, or whether it's looking at bigger picture like government and manufacturers and large supermarkets. Maybe there's some agreements that can be done about transporting goods that are going to communities with support around reducing freight costs, or looking at accessing better promotional deals from manufacturers and a better range of, products that aren't branded that you might see more in cities as opposed to remote communities. So I think it doesn't account for all the costs and challenges that remote stores are operating in by just saying open up for private for competition.
No, No, great answers, girls. I pounded you a bit with the answers, with the questions, and you did very, very well. So, yeah, great answers, and thank you for being so honest and open. Lisa, I might go back to you and sort of think about government in response to requests from community and supporters for subsidies to lower the cost of food in remote communities raises concerns about subsidies not being passed on to customers. Is this a valid concern in your eyes?
It is, Nikki. And just to remind everyone too, it would have been about 20 years ago when we did look at trying to get government to subsidise food, and government said they wouldn't. So just bearing in mind that hopefully, you know, if we're looking at subsidising food again, that they might consider this more of an option. Yes, so this is what I spoke about probably previously when I mentioned that there needs to be better regulations in place, so that if there are subsidies, that they are actually passed on to the consumer, and that you know, that there is benefit at that end. So yeah, when you're looking at that.
Yeah, I think it's really important to think about that, and I still don't think that not everyone in government, some people in government don't understand all that, and there needs to be a lot of internal work. I think we can tell them. Everyone online, I'm sure, can tell them what's needed. I think it's more about listening and knowing what's happening out there. So thanks for that. Lisa, we're nearly getting to the end, but Karina, I had a question for you about the funding that you get. If the funding ceases, what happens? What do you think happens if the funding ceases?
Well, we currently don't get any funding for the stores. So, I mean, the stores are running really well with the model that we have, but we do need funding that's dependent and dependable and ongoing, and is enabling, because currently we don't get that. And the funding that's out there is either for one-off projects, or it creates more work for organisations. So that's definitely the first thing that we need. Also, I guess the supply chain, it's at the moment it's quite complex. Like you mentioned, we get our groceries from Darwin, which is over 1,000 kilometres away, and we have a local Woolworths here, but we have to source it from Woolworths in Darwin. So we're currently trying to work through that. It's quite a complex process, and ideally we want to make that process easier so that we can have more community involved in that process, and yeah, just make the foundations of the store a bit stronger.
Yeah, thanks for that. And it is about funding, and you mentioned short-term funding, and we all know when short-term funding comes, it's great to get that funding, but it's usually 8 or 10 weeks, and it's not, you know, you don't see a lot of behaviour change in that time. So it's about that sustainability, isn't it, also? So that's really important that we talk about. So there's a question here from the audience also, for anyone on the panel, maybe Lisa, is there a policy that the big supermarkets can subsidise for remote independent stores?
Sorry, I just had to sneeze.
Bless you. Yeah.
That's a good question, and I don't really know the answer to that. But there could be opportunities when you're looking at the buying power of these large supermarkets and how that can actually be passed on to some of these smaller stores or independent stores, because the buying power itself will actually reduce the cost of food.
Yeah, and I'm not sure if anyone else on the panel, Karina, did you have anything that you'd like to add to that? Is there a policy?
I mean,
should there be
I don't
one?
know if there's a policy. We are currently working with the Woolies at Work team. It's been a really long process trying to work through these complexities with Woolies, and at the moment we have a senior account manager working with us, and there has been some discussion about potentially having wholesale pricing available to us, but we're just in the early stages of those discussions.
Yeah, that's great. So I'm not sure if there's any other questions in the panel. This is your big chance to ask these very wonderful, clever experts that we have here. If anyone online on the chat would like to ask any questions for our panel, please put them up. There is, that's a new one, yep. Is there a noticeable, I'm just trying to, you know, anyone that knows me knows I can't do more than 2 things at once. I'm trying to do 3 here. Is there a noticeable difference in the food access and availability between the government-owned store model, such as Outback stores, privately owned stores, and community-owned stores? Whoever would like to answer that. So they're sort of just saying, is there a noticeable difference in the food access and availability between the different models of stores? Karina, would you have, yeah?
Oh, I mean, I really only know with the model that we have with trying to make the price of food the same as if people lived in town. We've definitely seen an increase of a change in dietary choices. We've seen an increase in fruit and vegetable purchases and a decrease in some of that non-perishable packaged foods. We've definitely seen that. We haven't been able to quantify that yet because we're so busy running stores, but we've definitely seen that. We have had people come from other communities that have had some of those bigger stores to shop at times as well. But I couldn't really comment on the comparison.
Yeah, no, thanks for that. Lisa, did you have anything to say on that one?
No, not personally. The only thing I can say is that there's regular market basket surveys and healthy food access basket surveys that are conducted throughout these stores. So it'd be good to actually look at that as the comparative.
It's another recommendation and job for us. So thank you for bringing that up. Just one last question here. Yesterday's panel discussed raising prices of junk food to subsidise cost of health food. What is the thought? I might go to Claire and Carolyn for this one. If we raising prices of junk food to subsidise cost of health food, what do you think?
Yeah, I might just quickly answer just that question beforehand, because it's just something that we were just talking through. I think it's around the difference between Outback stores, privately owned stores, and community owned stores. I think that's a really tough question, and I think it comes back to like with government owned stores and community owned stores, if they're part of a store group, then often they will have better access to like stronger buying power as part of that collective and have other policies in place, you know, a team to support, whether it's merchandising, infrastructure, takeaway. So a bit more of a, I guess, comprehensive approach to running remote community stores across different communities, which can help make things more efficient, as opposed to private stores, which might just be operating by themselves and doing all of the purchasing themselves and all that kind of stuff. So that, I think, is where you see the differences, is with the store groups with bigger powers and, buying power, and probably more comprehensive policies in place around pricing policies and stuff like that. Yeah, hope that kind of semi-answered our thoughts in that space. But yeah, I think it's very hard to say if there's one or the other that's better, but there's different approaches and different policies. In terms of prices of junk food to subsidise costs of health food, I think it depends on where you stand. I mean, from a health benefit perspective, my personal thoughts are it's always good to create a supportive environment for people to help make it easier to choose healthier options, and therefore increasing the cost of junk food to reduce prices of fruit and veg or healthier options is something that I would be looking at supporting to make it more affordable for customers.
Yeah, I agree. I also think we have to, I guess, do a staged approach. Like, we would want to at the same time create that supportive environment, and I know education is one component, but also make sure that we're supporting people to be able to cook at home, and because people might be reliant on junk food for other reasons. So just making sure, if we're going from the social determinants perspective, that we're looking at that as just one component of it and addressing the other factors, so that people aren't, we're not making a bigger barrier for families to even have any food.
And I think I've been wanting something like this to come up, this question to come up in the last 3 sessions, and it hasn't. And it gives me the chance to say, this is why we need so many more community nutritionists in the field, and to do this education. Education is really important. You know, we have to make sure people know and aware of what is in the food and the impact of that. So I've been dying to say that Indigenous nutritionists, non-Indigenous nutritionists are needed for that education and knowledge in communities. So thanks, girls, for saying that, because yes, it's been great. One last question here. I know we're going to run out of time again, but the sugar film highlighted a remote community that did not have sugary foods available in the local stores. The health promotion program that implemented that model ceased. Now that community has a dialysis unit. Was that a program that had legs to be reintroduced? I'm not sure who wants to answer that, but this is the issue we talked about before with health promotion programs: short amount of funding, not sustainable, and then we go into you know, people having other problems, and the community having high stats in renal failures. So does anyone want to quickly give me a 1-minute answer to that, if possible? Or do you think I've said it all?
I think that community was in Central Australia from memory.
Yeah, it was. It was actually a Mayweather stall, and decision. This is in the APY region, and the decision was to not sell any sugary foods. Whether that was directly linked with the disease renal dialysis, we're unsure of, but it did relate to children with less dental caries and those elements. With dialysis in particular, a lot of it is over a longer term, and it's often from poorly managed diabetes, so there could be some association there.
Yeah, thanks for that, Lisa. And again, it's about, like we said, about programs and about making sure there's programs in our communities for all parts of our body and for all parts of the community and our people. So thank you very much to the panel, and thank you to the people that asked questions. I just wanted to put up this this slide about our wonderful working group. Without you, we wouldn't be able to have this webinar and have this series online. So thank you to everyone involved in that also. And also join us tomorrow for our last series, last one of the series. And there's all the details on there. Remember, you've got your links there for Monash to get involved and have a look at our previous ones. Also, you can have a look at Zara, what Zara's done. They're online also with all that. So there it all is from today. So, and there is another thing in the chat there from Graham that he's talking about in his travels. So thank you very much, everyone, and I hope to see you all again tomorrow, and take care.